Good evening. Welcome to Detours, Understanding Acquired Brain Injury. Tonight, I would like to talk about the emotional section. I've done the cognitive for helping a loved one when they get home from the hospital. And tonight, I'd like to talk about the emotional side of it. There's many different emotional symptoms after a traumatic brain injury, whether it be mild or moderate to severe. The first one is anxiety. It's very common to have anxiety. There are many triggers that can bring on the anxiety, whether it be within their mind or physical, whether they shake or depending on what it is. Then we have depression. Depression is very common with traumatic brain injury. A lot of times, the loved one could have had depression before and anxiety as well, but after a brain injury, it gets worse. It could get worse, unfortunately. Um, there's times where it could be very deep thoughts or dark thoughts, I should say. That's never a good thing. Um, and it's how they can get help for them, from their loved one, whether it be how their loved one talks to them or how they, deal with their outbursts or their, agitation. That's a big one because they think it's about them and it's not. Um, a lot of times the loved one doesn't know that they're having this reaction, unfortunately. A lot of times, the caretaker needs to walk away, you know, just to get, a break, and it helps the loved one get a break too, to be able to relax a little. And then, the caretaker will come back, be able to talk to them and find out, how they can help them with, if they can find out why they why they are feeling the way they're feeling. It depends on how they want to deal with that. A lot of times they may want to go see, you know, seek medicine or a therapist. Um, that could be important too. But definitely if they're going to seek medicine, definitely keep up with the doctor and make sure they know they had a TBI, and as well as the therapist. Make sure the therapist practices, you know, with traumatic brain injury patients, because there are ones that don't, but you usually don't know that until you're halfway through. I've had that in my past too with my current therapist. Yeah. So, let's see, there's also support groups. There's ones for the patient and there's ones for the family as well. Let's see. I may be skipping around. I'm sorry if I am.
Yeah, it's okay.
Drugs and alcohol can actually make your depression much worse. I know. Also, what can also help is coping skills with, how to kind of calm down yourself, whether it be just, deep, deep breathing, you know, just rest, just to get, just take a break, or maybe just getting your mind off of it and trying something different, like maybe watching TV or doing puzzles or, whatever or maybe doing computer games just to get your mind off whatever's bothering you. I don't know if that would help,
Yeah.
but you never know. Honestly, excuse me, what helped me when I came home, because I had two
Mhm.
traumatic brain injuries, and when I came home from the first one, I would get into a very dark place, and that scared me. And basically, when I would have those thoughts, reality kicked me and says, you have your children and you have your husband.
Mhm.
And then it's like anytime I would have those thoughts, that's what would happen. And then those thoughts would go away. I don't know how it did it, but that's okay. I went with it, you know? And that's what comes to mind every single time. And that's not all the time. It's definitely cut back a lot, thank goodness. Let's see, I'm trying to think what else as far as the emotional. There's so many. But yes, a lot of it is, oh, if your loved one does have an an emotional outburst or is not very nice to you, don't give in to that kind of behavior. Just walk away and tell them, I will be back when you have calmed down.
Mhm.
And then you do that and then see what you can do, see how you can rectify the situation. Because that's not going to help you or them.
Mhm.
Um, trying to think. I think I pretty much covered everything. Can't think of anything.
There are a few little like things to keep in mind. A lot of people with, I mean, this is something that affected me. They appear sometimes. This is connected, but it isn't like. There's something called pseudobulbar affect. What that is may appear to cry inappropriately or laugh inappropriately. This is not um, reflective necessarily of their mood. It may be in direct opposition to how they feel. This has to do with how mood is regulated, controlled through expression. It does not mean they feel this way. It has to do with how it is controlled and expressed. There are medications to help. Um, Nudexta, for example, is one that can help with like crying when they would be laughing normally, or vice versa when in a sad situation laughing. Um, the neurology is a bit complicated, and I'm not going to do that here. At some point, when I do neurobiology, I can get into that. Um, Also, something called pseudo depression. It looks as though somebody's depressed. They're not. They're feeling actually apathy. No real feeling at all about anything. They seem not to care. Um, Typical frontal lobe injury, complexity, because they're not able to process the
Mm,
situation right because of lack of awareness. I've talked about anosognosia
yes.
before, which is the lack of awareness of what has happened. It's not necessarily, it's not saying they don't like whatever, they just don't get. And this is tied into, again, I've got a video on that topic, alexithymia, which is where they don't recognize their own feelings. They could be yelling, shouting, and you ask them, why are you mad? And they're like, I'm not mad. Yes,
Mm-hmm.
yes, you are. But they don't recognize their own emotions. It's the alexithymia means literally without stories. Um, and what it is they don't recognize their own emotions. And so they have to be taught how to recognize their own emotions again. And with that, unfortunately, often comes a lack of empathy for others. Because if you
Yes.
cannot recognize your own feelings, you certainly can't recognize them in others. And so they may behave in a way they don't seem to care if you're crying, if you're upset, if you're saying you're feeling lousy. Where's my dinner? Because if you can't recognize feelings in yourself, you can't recognize them in other people. There are things you can do to help with that. Um, it usually does take a little bit of help, rehabilitative help. help them. Basically, one of the things is like helping them recognize their own feelings and teach them to, they have to learn to recognize facial expressions. One of the studies has shown that oftentimes part of the problem is they don't recognize what meanings of faces mean.
Mhm.
Basically, a neuro blindness in effect to like angry faces and like other faces. And if you don't recognize that, you cannot appraise how somebody else is feeling. Um, Problems recognizing tone of voice. And
True.
then there's impulsiveness. Good Lord knows that a lot of us are just like act on impulse, do things like whoops. And that leads to saying things that we probably shouldn't say. It's almost like if you've ever dealt with like a 6 or 8 year old kid with ADD, ADHD, who
Mhm.
pretty much says, hey, that lady is fat. And you'll find maybe your survivor, your loved, loved one is like, oops. And that's kind of cognition as well as emotion.
Yeah, it kinda goes hand in hand
And
in a matter of speaking.
they're highly connected. Again, it's kind of a complicated thing, but yeah, cognition and affective control are kind of, kind of.
Mhm.
There are more serious situations where there's an extreme regression, almost like you're dealing with a 2-year-old. Um, these are rare cases, but they do happen. An extreme brain injury where a person basically seems just like a toddler. Um, those cases are much harder to treat. Um, Before you would bring somebody home, you would know that's what you're dealing with. Um, Many people in this situation, they end up in nursing homes because they're just not, yeah, you're just not capable of handling them at home. Because, like I said, they end up being like a big old toddler. There is some improvement in many cases, but they'll always be like a child. Personality change wise, which you often do see,
Mhm.
um, they'll have traits of almost like the old cluster B as it used to be back in the days of DSM-4 TR. A little bit of antisocial, a little bit of borderline, a little bit of like narcissistic, a little bit of histrionic, a little bit of, a little of this, a little of that. It doesn't matter what label you put on it. It doesn't matter what you're going to call it. Although technically you call it personality change due to traumatic brain injury or alcohol damage or whatever. Doesn't matter what you call it. You have to deal with each behavior individually. And to manage those kind of things, you'll use a lot of behavioral techniques. Because just like you would a 5-year-old, 2-year-old, it's the same way. Now, you don't patronize somebody, please. Um, Really, it's not a matter of choice. They're not that way because they want to hurt you or anything. It's not intentional. Even some of the more manipulative seeming behaviors, they don't know. Even if they think they know, even if they think it's intentional, the very systems that tell you they don't work. Um, they think they're being clever or whatever with this kind of, and it's blatantly obvious. Broken cognition too. So it's a matter of finding out what the triggers are. Finding out this is antecedent behavioral analysis. We've talked this a lot, and we're going to continue to talk it. Find out what triggers behavior. It's usually the basics: pain, hunger, fear, anxiety, depression, all the stuff you talked about. It's one of those things that's setting them off. Confusion is a big one. Um, Distorted perceptions of reality. And if
Yes.
you can figure out what the triggers are, you may want to list them, keep track. When you see this situation, you try to nip it in the bud. If you do that, you can prevent a lot of the behaviors in the first place. Like where you were talking about, like you're feeling depression stuff. Um, some of the ways to deal with that. I dealt with some really dark situations in my early days. I tried to commit suicide twice, and
Mhm.
part of it is you feel a loss of sense of meaning, who you are, destroyed, what you were from before. What's my purpose?
Yes.
What is my purpose? Loss of existential definitions. Um, so finding something useful and helpful, a purpose, instead of just staring at the bloody TV. You've got to find purpose, especially as you're higher functioning. The less, actually, in a strange way, studies show that people who have milder brain injuries do worse with like the psychiatric issues. Why? Because they are aware of what they were before, who they were, the meaning, but the disabilities usually are just enough they cannot be. So they have to redefine themselves. I've mentioned this before,
Mhm.
and this is why like finding purpose and meaning is important. And not, again, not in a way that is insulting or emotionally belittling. A valid meaning. You may not be the high voltage. I mean, if you've ever seen like Regarding Henry or like any of those kind of movies, you need to find purpose that is meaningful, even if you could never be that high power lawyer he was. He trying to find something useful, purposeful. And again, if you've got mild or brain injury, mild, moderate, and you can't find purpose, that is fuel for suicide and bad behaviors, aggression, all that stuff. And that's usually deep down, those feelings of worthlessness and um, loss of sense of self. And without that to hold you together, part of the reason you are able to resolve it is because thinking of your husband and your kids reminds you that to you is a big part of who you are, and you still are able to do it. So you have
Mhm.
purpose. But like a person whose entire meaning is defined on, say, their career, um,
Yeah,
if they can't
that's
do that
true.
anymore, they're in a bad place. In fact, the number one factor for people of working age after brain injury that determines how well they'll do, psychiatrically, psychologically, everything else, employability. It doesn't have to be
Mhm.
the same job, but employability, number one factor. And guess what influences whether they're employable or not? It isn't their intelligence. It isn't the cognitive. It is psychosocial factors. Forgive me
Mhm.
for putting it this way, but are you an asshole? And so those problematic behaviors have got to be fixed. And
Right.
that's where rehabilitation and like can their socialization skills be fixed? And one of the keys is helping with that anosognosia, that awareness of deficits. Because if they're not aware that they've got those social deficits, those behavioral deficits, they won't realize they need to fix them. And so when they act inappropriately, at work, they end up either terminated or at a much lower position or with much less trust, and they don't get the satisfaction. So fixing like the anosognosia is important. Fixing, the mouth that says things shouldn't, working on collaborative skills and all that stuff. So this stuff is key. This is the most important of those kind of things. And so if you're dealing with a loved one who's got problems with these areas, this is the key area. So finding a psychiatrist who's an expert in brain injury medicine. This is that subspecialty
Mhm.
again, brain injury medicine. Um, Therapist who has experience. Unfortunately, there are no credentials specifically for counselors and now for psychologists. That one's an easy call. Look for a neuropsychologist.
Mhm.
They're trained both in doing clinical psych as well as they're experts in brain science. But be warned, their therapy skills tend to be a little, but they at least
Yes.
can, because those of us who do, or those of us who studied, I'll be honest with you, ask me how much real training I got in doing talk therapy.
Mm.
That might be about how much. Um,
Yeah.
Most of the work I did was neuroanatomy, neurophysiology, reading, scans and like doing statistical analysis and like how
Mhm.
to do academic studies and brain. Yeah, they're really more neuroscientists than anything else, but they can do some, even if it's that much, and maybe point you towards therapists and things who can help you. And they know who's got the training. There are books and other things for therapists out there, and this is for any therapist who's watching. This is a large population with acquired brain injury. Please study some of this stuff. It is important. A lot of behavioral techniques work. Dialectical behavioral therapy is effective. Studies show, and cognitive CBT is effective, but DBT is very effective. Certain medications, the old research shows that the old SSRIs are effective with mood, and also beta blockers work as well as anticonvulsants are effective at mood stabilization.
Right.
All right. Yeah. All right. Sorry.
Well, I was also going to say, the caretaker, what's important also is do research,
Yes.
understand what your loved one is going through. It is so important. And
Yeah.
whether it be, whether it be about anxiety, depression, whatever, you notice about their behaviors,
Yeah.
it's
Yes.
so important to research. That way you can understand and accept,
Yes.
what they are going through to the best of your ability.
Yeah.
Even though you're not going through it, but you can still understand.
Yes. Yeah. Empathy and forgiveness. They're going to mess up a lot, as you would your kid. Again, while you shouldn't talk down to them,
Hmm.
treat them emotionally as though they're like 5 or 6. Lots of extra kindness and support, forgiveness, understanding,
Right.
like that kind of warmth and stuff. They need it while they're learning. Don't let them abuse you, but do like be empathetic and seek therapy yourself. You're going to need it.
Yes.
Group and marital and family therapy, very important. Go as a couple and one that knows brain injury. There aren't many, but there are some who do know brain injury and who can help, like with a couples, even if you have to go video, you have to go like Zoom or whatever to do it. Um, Couples
Oh,
therapy is essential,
yes.
maybe even whole family therapy. Um, and in order to like work through, but you yourself as caregiver, it's essential that you do therapy because you're going to feel angry, frustrated a lot. And while many marriages do stay together, people stay together long, like your chances are better. The statistics show actually that people with brain injury, their partners actually are more likely to stay with them. But as always, there's a catch. And that
Mm-hmm.
catch is you may stay with that person, but your lives are almost lived separately. It's almost like
Hmm.
two roommates. And the reason they don't leave is because they feel guilty leaving a disabled person. And that's why they stay. It isn't because, oh, I want to help them out and I want to be a nurse and a therapist. No, they stay because they don't want to be judged by their friends and they don't want to be judged
Hmm.
by the pastor in the community. That's why they stay. So, the way to deal with that, seek counseling and therapy.
Yes. Well, like
Um,
I also said about support groups too,
yes. Yeah, definitely.
it's very
Um,
important.
That's a good point. And it's like you've been married for quite a while. I mean, you passed your silver anniversary, so that's impressive. The vast majority of people, even those who stay married, things just kind of disintegrate. And recognizing the bumps and the ups and the downs and the continued communication is essential. Um, Stacy met me long after I was hurt, so she just knew I was kind of weird, and I explained, and I am kind of weird. I mean, but that just came with the package. She just said, I just figured you were a little weird and quirky. Hey, and it's like I have other issues too. She knows that.
Hmm.
But that comes from other places though. But yeah. Um when you're pure blood nerd like I am, academic and all that kind of stuff, that makes you weird too. You just mix that into the stew and it's just guaranteed to be a mess. But
Oh, yeah, absolutely. You
um
do the best you can.
that is true. And that's good advice also. Um, so, it's just like the emotional issues are probably the most difficult to deal with.
Yes.
One more thing I forgot about, and that I get emotional lability. I would assume you're not so bad with that one, but I am. Emotions for a lot of brain injury survivors change like that. We can be weepy, sad, angry the next,
Yes.
happy the next,
Oh,
and it's
yes.
all just the same to us. I
Oh,
mean,
yes.
my happy is just as valid as my sad or my angry, and it changes in a millisecond. And
Yeah, there are days I have that. I mean, and then,
oh,
it kinda subsides for a while. But yes, I was getting that a lot after my
oh,
first
yeah.
brain injury. It was driving me nuts.
Yep, and that emotional ability usually is more
Oh.
common on right frontal, and it's just like, and some people are like, you know, I feel sad, but I can't show it. Flat
Mhm.
affect. It doesn't mean they don't feel it. It just means they don't show it at all. Their face is kind
Right.
of like a permanent poker face. The way to
Mhm.
deal with that, to find out whether they're actually having trouble expressing their emotions, whether they have problems with affective empathy. And empathy is a complicated subject. My video about that deals with it. There are three different things you look for: affective, cognitive, and compassion.
Mhm.
Um, that's a separate issue. But if they had just simply have flat affect, which is they cannot show, it's a little
Right.
creepy sometimes because their face is like, I had problems with that because of damage to the nerves and some of the structures. Ask them how they feel. If they say, I don't know, they may have alexithymia where they cannot recognize their feelings. And then you want to talk to, again, a psychiatrist, expert in brain injury medicine. I cannot stress that one enough. Um, and there are treatments, again, like Nudexa helps, as well as like there are specialized retraining programs to help with recognizing emotions and with like helping with re-expressing things like that. Again, too complicated for here, but yes, there are things that can be done. Um,
Yes.
but people with true flat affect feel. They feel happy, they feel sad, they feel everything. They just can't show it because some of the control systems, again, it's that linkage. Pseudobulbar affect is wrong emotion for the situation, happy versus sad, wrong emotion is shown. Flat affect is
Mhm.
no emotion is shown, but they feel it. Same thing with the
Right.
pseudobulbar affect being wrong emotion shown, but they feel the correct. Flat affect, correct emotion felt, not shown. And people are a little unnerved. It's like, hello. It's like, yes, feels are there, just not able to express. And unfortunately,
Right.
if you have that, you've got to learn to show your expressions with other parts of your body, like say your eyes and eyebrows, like I do.
Yeah.
Facial hair helps too. Many
Mhm.
people with it have like Bell's palsy. Their
Yes.
lip droops or their right eye down a little bit.
Mhm.
You learn to express by using voluntary control, and eventually it becomes second nature. And if you're animated enough, you can definitely show how you feel just by like well. And if you're a touch hyperactive, which by the way, another one is with this executive syndrome, you kind of like you know anyway. Oh, that's another logorrhea. You don't shut the hell up. Either talk too much
Mhm.
or not at all. That's kind of tied in with cognition. I think
True.
um that there again, something else that's really rare. It does happen. Again, you would be told this before they went home, at least if your therapy system is any good. And I don't want to make anyone kind of scared about this, but it's called pseudo sociopathy.
Mm.
What is this? Incredibly rare is what it is, but it does happen sometimes. Some people damage to certain white matter bundles, specifically uncinate fasciculus, frontal lobe injury, lose
Mhm.
contact between the ventromedial aspect of the frontal lobe, which is like right behind the eyeball, and the amygdala. The amygdala lends emotional tone to your memories, to your thoughts. Um, Allows you to like add weight, not weight to your memories. So if you lose the ability to, like, if for your kids, your spouse, whatever, those memories matter because they have emotional weight to them. You
Mhm.
love that person because positive, like emotions. If you lose contact with those emotions, Sure, you may remember the person, but they're no different than a stranger to you. So if you hurt them in the process, who cares, right? This is what the problem with pseudo sociopathy. All their memories are stripped of their emotional weight. And
Right.
so nobody means anything to you. Heck, you don't mean anything to you anymore either. So if, to get food or to get money or whatever, you got to kill somebody, whatever, that's fine because you've got no emotional weight to your memories or anything. Rare. These people do usually end up in jail because they have no ability to apply any affective weight to their memories, and vice versa, because they get no feedback from their body that maybe you shouldn't be doing this. They get no butterflies in the stomach or any of stuff because they've lost connection with the amygdala. Rare, okay, not common,
Mhm.
but it can happen. If your rehab is any good, they'll tell you, "Uh-oh, this is the problem."
Right.
Um, Rare. I'm going to stress this again, not common. Um, Damage to it looks a little different. They seem a little more cold, a little more callous, a little meaner in the way they react. Takes more effort to get them to feel the feels. Uh, More common, not super
Yeah.
common, but more of a callousness. I don't give a shit if I hurt your feelings as much. It takes more to get me to care. You see this with some psychiatric disorders. Some of this look like narcissism and stuff like that, but it's more a developmental change in the unsynaptic
Hmm.
fasciculus and its connections. There is more hope with them through like teaching and stuff like that. You get like a thicker bundle of stuff. It's more complicated. We can get
Hmm.
into it if you're interested.
No.
I'm not saying at the moment, but it's like this could be a future kind of thing, how it works. But collateral axon sporadic stuff like that. Yeah. So, but it's rare. Again, it's rare. But damage to these areas of frontal lobes is not. And so you get some weird responses, more Machiavellian, like I'll do what I have to get what I want, like with Parkinson's disease in certain cases, and some. Um, but again, most of these people have trouble with their abilities to plan, think ahead. So you get these with some dementias too, which is weird, like frontotemporal dementia and stuff. This is why that they may take like 5 candy bars from a store when it's like sweet old grandma. It's like, what the hell is she burgling the store for? These areas of the brain not working right no more. Why is why did you know pop set the house on fire because he thought there were you know
True.
bugs beneath it. These areas of the brain just aren't working anymore. Uh, he ends up, like with a fine and in a lock unit in the local nursing home. Grandma running red lights because these areas of the brain aren't communicating anymore. And you might see this with acquired brain injury patients
True.
because, again, a problem communicating between the areas that tell you don't do this and frontal lobes, which help. The areas giving you emotional tone not working right. Again, not common, but something to watch out for and to understand why. Mm, Again, that neurophys, neuroanat, and cognition
Mhm.
kind of complicated, but this is also affective roles as well. Feedback from the body, not as strong as it should be. Someday I'm hoping we can provide synthetic input, something like that. For now,
Mhm.
it's like there's not much to do in those extreme cases. You can like do some reteaching, teaching compassion, stuff like that through positive reinforcement. Skinner, that's something else. Positive reinforcement is more effective than punishment
Oh, yes.
because of the way that the neural circuits are. Um, they don't get the amygdala feedback as strongly with certain types of damage. Um, some people ultimately end up being confined anyway, either a lock unit in nursing home or prison. Um, because of damage, a large percent, 85% of the women who are in jail for violent crime have brain injury um, due to domestic violence. More than 50% of the men. And it's mainly because we really can't treat brain injury, those who have frontal lobe injuries mostly. Usually, again, due to violence, getting beat up as a kid, stuff like that. Parents abusive. And many of them, in turn, also have brain injuries. So this is unfortunately the fate that awaits a lot of them if we can't get appropriate rehab, cannot fix some of the damage. But if you have a good rehab, they'll let you know if this is like the situation, and you've got decisions to make then as a caretaker what to do. Yeah, sorry, I don't mean to end on a down note. This is not a majority. This is not a majority of the cases. This is a very small number, but it does take planning, discussing with a physical medicine doctor and with a rehab
Yeah,
specialist and things like that. I'm not going to lie to you; it is a difficult situation, and
very.
um, yeah. And I know you and I both have had like irritable outbursts and stuff like that. Everyone I know has had like moments of being angry, and it's okay to be angry. Anger is something that's common with us because we have some impulse control problems. Sometimes don't understand what's going on or can't make sense of things. It is aggressive behavior that is the problem,
Yes.
and it is not acceptable. Disability is an explanation. It is never an excuse. And you, as caretaker, have to know that you need to stand firm against that because you can reinforce the wrong behaviors. If you give in, it's telling the survivor it is okay to treat you that way. You've got to be firm and strong and make it clear that it's never okay.
That's right.
Okay? Never. And no one can ever lay a hand either on anyone in the family. All right. And if that means calling the police, that's okay. Okay. There are got to be hard limits. That is one of them.
Exactly.
Okay?
Very
Seriously.
important.
That is a hard. And if it means heavy duty medication, if it means stronger stuff, that is okay too. No one has a right to lay a hand on another, regardless. Disability is never a license to be a jerk. Never. All right. I apologize. That's just one of my rants about DV. All right. With apologies.
That's okay. Well, hopefully, this video helped. You know, we will have I will have other videos, within the family to try to help family, with their loved ones when they come home from the hospital, how they can care for them. So yes, thank you very much for watching the video. Please like, subscribe, and share this video because I'm sure everyone knows, a family member or a friend that does have a traumatic brain injury or had it. And
Yeah,
these videos can help them too. At least I hope so.
I
But
think
yes,
so. And
please definitely subscribe and like.
don't forget to click that bell icon. And Lisa's going to be doing a lot more of these independently now. So she's going to be uploading her own videos, doing her own thing. So look for Lisa's side in detours.
Thank
Bye.
you. Bye bye.
Bye.
Mhm.